Timing can be everything in a woman's quest to become pregnant, especially if she struggles to conceive. But doctors say there is one test on the market that can reveal the perfect time, and they're offering it to more women. KXAN's Gigi Barnett explains how it works.
This is my son.
Beautiful and unborn, Christina Michaud's little boy is on the way. It's been a long road getting to this point. 10 pregnancies, 8 miscarriages, and several surgeries, and finally, a second child.
It is the most magical thing. I can look at that and just makes my day happy.
Michaud is an IVF patient at the Texas Fertility Center. She conceived her first, a daughter, using IVF too. But when she and her husband Justin decided to try again, sad days followed.
And I still had 4 more, I think, miscarriages. All from IVF.
Then her doctor switched gears and decided to use a fairly new test. It's called the endometrial receptivity assay, or ERA for short. It feels a little like a pap smear, and it measures the amount of pregnancy-sustaining protein in a woman's uterus, telling doctors the exact day that her body is ready to receive an embryo. It is personalized timing that's unique and specific for each woman.
Every patient who comes into our office, all the information we need is right there in her body. We just have to become smart enough to figure out where to look.
Dr. Galen Silverberg heads up the fertility center. In a sampling of his most recent high-risk patients, pregnancy rates jumped from 44% to a little more than 70%.
We've gotten to be so good in the IVF laboratory that we can get even better pregnancy rates transferring fewer embryos.
While this test is only for IVF patients right now, Dr. Silverberg believes that in the coming years, he'll use it on his other patients undergoing infertility treatments.
I think it's just going to continue to explode.
I was very prepared for it not to work, but I was thrilled and shocked that it did.
And now her baby boy is due in June. I'm Gigi Barnett, KXAN News.
Only about 30% of couples who see a fertility specialist undergo IVF. Basic IVF can range from $13,000 to $20,000. The Texas Fertility Center says when the ERA test first hit the market a few years ago, it cost at least $1,200. Now the center offers it for about $700.